everyone, I'm Elizabeth Ortiz. I am a board certified internist and rheumatologist based out of Dallas, Texas. I have been working in academic medicine for the past 10 years in rheumatology, and I'm now building Connected Rheumatology to allow me not only to treat patients, but to really dive into education. Because I believe that through education and good communication, we can all get healthier. And here at Connected Rheumatology, we talk about all things rheumatology, immunology, diet and movement, and wellness, because you know, it's all connected. So today we're going to be going over some of the nuts and bolts of what happens when you go to see a doctor for joint pain or when you have arthritis. Sometimes it's an easy diagnosis, sometimes a little more investigation is necessary. So when you go in, obviously one of the first things they talk about is what's going on with you, and they're going to just ask the basics. So where is the pain? Is there anything you do that makes it better or worse? Are you taking anything for the pain? And this is where you're going to tell them if you're taking Advil or ibuprofen or Tylenol or your cousin's CBD oil or your husband's Vicodin. Like, you want to make sure that you're honest with them about what you're taking. And then, does the pain travel anywhere? They also are going to ask you about other things going on with you. Now, you might be surprised to get the question of if you're having diarrhea or any rashes or headaches whenever you're going in to talk about your joints. But these things are important to cover to make sure that there's nothing else going on. After they talk to you, obviously the next thing they're going to do is look at the joint. Now, in a perfect world, they're going to look at all your joints, but sometimes time doesn't permit that. So what are the things they're looking for? Well, they're looking to see if the joint's swollen. They're looking to see if it's hot to touch. They're going to see how well it moves. Does it move fully, or does it cause pain when they get to a certain point? Does the joint get stuck? They're looking to see the muscles around the joint. You know, sometimes when we have an arthritic joint, the muscles around that joint can get weaker, and it happens so slowly that we don't even notice, but that's something that the doctor will take note of. And then finally, they're going to look to see how your other joints look. Even if you're not having any complaints and you feel nothing in those other joints, there can be clues in those joints that help the doctor figure out what's going on in the joint that is causing problems. Now, it's at this point where you are either going to get a quick diagnosis of osteoarthritis, or you're going to be told you need more tests. Now, osteoarthritis is a diagnosis that doesn't need any other tests for it to be made. And to learn more about that, you can check out our previous video on the difference between osteoarthritis and rheumatoid arthritis. I'll put the link in the description box. But it's kind of a see it and know it type of diagnosis, so it can be pretty quick. Unfortunately though, sometimes we do need more tests where we're a little confused based on what we see going on in other joints, or maybe based on some of the symptoms you said you had, and so we might need more tests. And so what are those other tests? Well, first we'll start with the blood tests. The first blood test is rheumatoid factor. Now, we talked about this also in a previous video, and I'll put that link in the description box. But rheumatoid factor is an antibody that, like it says, can be seen in rheumatoid arthritis. Now, if you watch that video, you know it is far from a perfect test, and although it's a piece of information, certainly doesn't nail down a diagnosis. And these days, rheumatoid factor is pretty much always done in combination with a test called anti-CCP, or anti-cyclic citrullonated peptide. These two tests combined can help us figure out if someone has rheumatoid arthritis. Along with these tests, your doctor might also check tests that look for a level of inflammation in your body. Now, inflammation markers, as we call them, go up regardless of the source of inflammation, meaning they can be high if you have cancer, if you have an infection like tuberculosis or COVID. They can be high if you have the flu. They can be high if you have rheumatoid arthritis. So they're not specific, but they're just another clue. So what are these labs? Well, the sedimentation rate, or ESR, is done in combination with CRP, or C-reactive protein. So these are tests that go up and down with inflammation in our body. They're non-specific, but if you come in with joint pain and you have a positive CCP and you have elevated inflammation markers, you can see where we're going, right? We are building a case that this person might have rheumatoid arthritis. Now, it might not just be rheumatoid arthritis they're looking for. You might actually also get an ANA check, the anti-nuclear antibody. This is another test we've talked about, and I'll put that link in the description boxes below as well. But this is a test looking for anything really autoimmune. It's associated with lupus, but it can be seen with a lot of different autoimmune conditions, and is just a clue or a piece of information that the doctors are checking if they can't quite figure out why you have joint pain. They're also probably going to check some of the basics. They're going to see if you're anemic. They want to see what your liver and kidneys look like. And these are all just pieces of information. None of them, except maybe the CCP, give a definitive answer, but they're all helping paint this picture for the doctor about what's going on. So that's the blood work. Next, we have the imaging, or the X-rays. Now again, you don't necessarily need an X-ray to make a diagnosis of osteoarthritis, although they are often done. X-rays can be very useful, but you need to know why you're doing them. So for example, if you fell, you're doing an X-ray to make sure you don't have a fracture. If you have arthritis, you're doing an X-ray to see how bad it is, what's the severity of that osteoarthritis. If you have rheumatoid arthritis, you might do an X-ray to see if the inflammation from rheumatoid arthritis has caused damage in the joint. So it's always important to know what you're looking for when you're doing these X-rays. It's also important to keep in mind the utility of an X-ray and where it's limited. I see a lot of people get overly focused on the X-ray. The X-ray might show some mild or moderate osteoarthritis, but that might not actually be the reason for joint pain. You know, the X-ray is only showing us the bone. There are a lot of other structures involved in the joint, from muscles and tendons and ligaments and menisci and fluid, and we don't see any of that in the X-ray. Things like movement therapy and physical therapy help those structures, and those therapies can help with joint pain without ever changing or touching the bone. So we just want to be clear that we are using the information we get from the X-ray and we keep it in perspective. And you know, X-rays obviously are not the only imaging that we do. We have CT scans and MRIs and now ultrasound, and these are much better at getting a look at the soft tissues, and they give us just more information about the joint. MRI in particular is really good at looking at the tendons and the muscles around the joint. Ultrasound can be done in the clinic at the time of your appointment, and it can show if there's fluid or inflammation in and around the joint. So all of these modalities, all of these tests are just other pieces of the puzzle that the doctor is putting together to try to figure out why you're having the joint pain that you're having. Now, once you get the results, a lot of times the next piece of information that we need is time. And I know this is really frustrating, but sometimes time actually gives us more information about how important those results actually were. Does your pain resolve quickly, or does it linger? Does it persist or even get worse? What happens to your pain is really important information to help us put into perspective the results of those labs and X-rays. You know, we make the best decision we can with the information that we have, but it absolutely happens where with more time, we get more clarity about what's going on, and we have to reevaluate what our initial impression was. If you get labs that were quote unquote abnormal, but then your pain quickly resolves, it might be that those labs just didn't really mean anything. And then the opposite is true. You might get labs that are all in the normal category, but if your pain persists, then perhaps it's time to take another look or maybe even see a specialist. So this was just a little quick reference on what to expect if you are going in to see a doctor for joint pain or arthritis. It's a great video to bookmark or flag if you have an upcoming appointment or if someone you love has an upcoming appointment. As always, I would encourage and remind you to keep a symptom diary. You want to make sure that you go in there with a specific information about what you're experiencing as possible. That really helps the doctor kind of narrow in on what they need to look for. And I hope that this maybe is a springboard for you to start investigating and thinking more about what you're experiencing. So thanks for watching. If you like this video, please hit the big thumbs up. Make sure you subscribe so you get access and you can see all the videos that are coming out. Check us out on Instagram, Facebook, and at connectedrheumatology.com. You know, we always are talking about all things rheumatology, immunology, diet and movement, wellness, because, you know, it's all connected. Thanks. Have a great day.